Hello, everybody, and welcome to another episode of the Surdentity Podcast. I am your hostess, Elizabeth Dewar Anthony, up here in Western New York, not in Florida anymore. You see, I have on a sweater, not my Surdentity t-shirt. I am wrapped in an electric blanket. It is freaking cold up here. And today I'm going to warm my heart by talking with the beautiful Dr. Maggie Augustyn. And we are going to keep it real today. We are going to talk about some stuff. So Dr. Maggie came to my attention through the Sober Life Rocks community. And but she and I have so much in common. You and I have so much in common because we're both about compassionate patient care. And we're both about, and I love bring back common sense behind you. Hello. How about bring back common sense and human decency? Hello. Um, why? And I don't understand why I can't get my fellow dental professionals to want to listen to me talking to them about how to treat patients better. It makes sense to me. My lived experience is that when I treat people better, things go better and I have a better day. And I don't know how to package that so it sounds more sexy or appealing or whatever, but I'm just going to keep talking about it. So, welcome, Dr. Maggie. I'm so happy to meet you.
Well, thank you very much, Elizabeth. And I'll tell you, it's really sad, but the best way that we have to get people to pay attention and the best way that we have to repackage this, and again, this is kind of despicable as sad, is to make is to somehow tie it to people's profitability.
Yeah.
Um,
Yeah.
which is sad. If you treat people like decent human beings,
Right.
there's money in it for you.
Thank
And that's
you.
the wrong way of doing it, but of looking at it. But unfortunately, in these days, it seems to be the only way to get people to pay attention.
And it's kind of sad. Um, and it breaks my heart because I see so much suffering among my fellow professionals. I in these dental groups that I'm on, there's all this ranting about these rude patients. My day is ruined because of this person, and it what I talk about is these people who are presenting to you as rude, as uncooperative. There is a reason that they are behaving that way, and that reason is based in fear, and that fear comes bottom line from the airway and not being able to breathe. And then there's a whole bunch of other stuff layered on top of it. You and I were just talking about PTSD, PTDA, post traumatic dental care anxiety. So the patient comes to the practice expecting a bad experience. They're already on the defensive as soon as they walk in, and there's a reason for that.
There absolutely is. And here's another important thing to understand. I sometimes answer these things within our community, on our Facebook community where I live. And one of the things that somebody wrote is they were looking for a dentist, and she had a negative experience with a dentist.
Mm-hmm.
And it wasn't necessarily just tied to a clinical experience, meaning
Right.
it wasn't just tied to pain.
Right.
It was tied to something that happened when it came to billing.
Mm-hmm.
Okay. And
Mm-hmm.
so, everybody is protective of their finances. And even though there is a lot of people that have, well, there are people that have a lot of money, and for them, dental
Mm-hmm.
care is affordable. There is many more people that don't have a lot of money. And for
Right.
them to be able to spend five, seven, $1,200 on a crown, they have to say no to a lot of things to be able to afford that.
Right.
And so they do suffer an emotional hardship when they get something done, and maybe there's a miscommunication, and the insurance doesn't pay, and they feel deserted
Yes.
and unsupported at the
Yes.
end of that, where it's like, well, oops, sorry, the insurance
Mm-hmm.
didn't pay. And I'm not saying that doesn't happen in our office. It does.
Sure it does.
But there has to be a way for us as providers to also help that patient process that. And I'm not saying it's a perfect system. And it hurts us when a patient comes back in and accuses us, because that's happened to me multiple times too.
Sure.
Just the other week, I had a patient that said to my team that the insurance did not cover his exam because of frequency, that he did not give permission for me to examine him. And
Mm-hmm.
so therefore he didn't want to pay for the
Mm-hmm.
exam, even though, of course, he readily opened his mouth, right? And so
Right,
it
right.
presented this difficult situation for him. But something like that can give him anxiety moving
Mm-hmm.
forward to see another dentist. And so
Mm-hmm.
it's times like this that we have to try to help that patient compassionately. Right.
Yes. The patient's emotional experience of their interactions with us is how they judge us. Okay. And if they don't have a positive emotional experience, and the patient's emotional experience can be completely removed from what we perceive through our clinical eyes. So it's how patients feel about what we did, not even what we actually did.
Correct.
How they feel about what we did is what matters to them. And that's what drives their referral, how what they say to their family and friends. That's what drives bad Google reviews. That's what drives lawsuits.
Yes.
So we have to, dental professionals have to remember that, the patient is not perceiving what's happening to them through the lens that we are. And if dental professionals could have a glimpse into the patient's lens, I really think that things would go better. How do you
Yeah.
feel about that?
Well, so in this particular situation, I had given this patient a lot of free treatment. This year alone, I think he needed 3 implants, and I placed and restored 1 implant at no charge for him. So I gave him
Mm-hmm.
$7,000 worth of free work.
Yeah, wow.
And it felt like he was stabbing me right through the heart, because here it
Sure.
is, and I gave him $7,000 worth of treatment for nothing, and he could not bring himself to pay me $54 for an exam. In fact, he accused me of not, of somehow strong arming him into an exam that he did not give permission for. And that didn't feel good as a
I bet.
provider, as a human being, as someone that considers herself to be compassionate
Yes.
enough to gift him $7,000 worth of treatment. And so that put me through a rigmarole
Sure.
of, well, do I act like a jerk and say, go somewhere else, I don't
Mm-hmm.
want you anymore, right?
Mm-hmm.
Or do you do the right thing for the right reason? And that really put me through quite a lot of emotional gymnastics.
Sure.
And I'm someone that really connects to the idea of stoicism. And
Mm-hmm.
stoicism preaches do the right thing for the right reason because it feels right in your heart. And so during that week, I ended up putting a screensaver on my phone that says, and it's still on there, do it anyway,
Yeah.
right? No matter how hard it feels, do the right thing for the right reason anyway. And so even though I didn't particularly emotionally within me want to do this,
Yeah.
I told my office manager, because he didn't want to talk to me, to call him back and say, write off the exam and tell him that it'll be at no charge, um, which made him so happy. Um, and I think that was the right solution. It kept him on as a patient. But of course, again, the emotional gymnastics that I had to go through, it
Yes.
didn't feel good. It
No.
really
Let's.
did not feel good. But what it did, though, is it gave this patient an emotional support that he's
Mhm.
now going to be able to, well, it's going to change his perspective. And what we agreed on with this patient is that, moving forward, both
Mhm.
he and us are going to be very vigilant about what the insurance does and doesn't cover. And that is going to be our gift to him. Now, whether or not he's going to actually recognize that as a gift or not
Mhm.
is an entirely different thing. But I think, and this is where, when we talked about the ROI of compassion, that comes in, right?
Mhm.
by exercising these kinds of emotional and mental gymnastics that we have to as providers on ourselves, you really are creating lifelong relationships with patients.
Yes.
Um, and maybe this wasn't an excellent example of that. I had a patient that came in yesterday and she comes in, and I know so many of us are going to be able to relate to that. I think a filling came out, and you look in the mouth and you take an X-ray and the tooth is split in half. There's no saving it. We talked about this tooth needing a root canal earlier in the year. We talked about this tooth needing a crown last year, right? And so she's just so afraid. She had so many experiences that were negative. And so she came in later in that day. Her blood pressure was 180 over
Yeah.
120 when she
Sure.
came in
Sure.
because she was so afraid because she'd had pain before with extractions. And so she went back home. She took her blood pressure medicine. She ate something. She came back in. I ended up removing the tooth. And at the end, she just looked at me and she held my hand. We talked a lot, which again, someone would say, and they have said this to me, you are wasting your time. You could be
Yes.
holding a handpiece and you could be drilling, and instead you are just talking to a patient that is below you, right? So she held my hand at the end of this, and um and we were able to get her blood pressure down to like 150 over 95.
Mm-hmm.
And with between, her medication and just a lot of talking.
Sure.
No anti-anxiety medication, no nitrous oxide, just relationship and talking and the blood pressure medication that she took. And
Amazing.
at the end, she holds my hand and she puts it to her heart and she starts crying. And she said, nobody has ever taken care of me the way that you have. I have been so afraid. That's why I have neglected my teeth.
Yes.
And I am so grateful. And I did not feel any pain, and again, so I spent an hour um, where it could have taken me 10 minutes to numb her up and take out a tooth. What did I do for her as a human being? What did I create in terms, if you really want to talk about cost,
Right.
what did I create in terms of my reputation?
Right.
What did I create in terms of a referral base,
Yeah.
right? Um,
Absolutely.
and why did I sign up to do this job? How many of us fill out on an application? I want to help people.
Mm-hmm.
And then when you're doing this job, you're holding a handpiece to make money.
Yeah.
Um, and so maybe that's a better example of utilizing compassion in terms of healing patients and in terms of healing ourselves. And I can't tell you, when I left the office yesterday, I kept remembering what it felt like to have her hold my hand by her heart. And then I ended up saying, it's really been an honor taking care of you. And I meant every single word.
Those are both actually great examples. Um, and because they show two different sides of what we're talking about. And I want to go back to, I'm going to talk about both of those experiences. I want to go back to the gymnastics you were talking about.
Mhm.
So kind of walk me through that. Like sort of like your feelings started here, went to this, went to that. Can you break that down a little bit?
The gymnastics with a patient that accuses you of forcibly doing an exam,
Right.
right? You start out with feeling unseen. You start out with feeling completely taken advantage of,
Mm-hmm.
because here you are, you gave $7,000 worth of
Yeah.
work and they can't pay you 50 some dollars.
Mm-hmm.
Um, and it doesn't feel good, and it makes you want to say, I am never helping another person again,
Yes.
right?
Yep.
And I think that's what leads to so much burnout. I think you
Yes.
get enough of those patients in the same week and in the same month. And that's why doctors and nurses and anybody in healthcare ends up leaving the profession. I wanted to see a GI doctor. The wait list is 8 months. Why do you think that is?
Mm-hmm.
There are no doctors,
Right.
right? Why? Well, because so many of them left. Well,
Yep.
why? Because we have assholes for patients sometimes, right?
Yes. Yes.
Um, but so you go through these mental gymnastics, and if you're not in the right frame of mind, you can't stop yourself to say, let me look at this from his perspective.
Yes.
And it took me many days to look at it from his perspective. And then the other thing that happens is you have your incredible team that rallies around you and
Mm-hmm.
says, you know what, that guy is a jerk and he is mistreating you. And that fuels that part of you that says,
Yeah.
you're right, I'm not going to do anything about it. Let him leave.
Yeah.
Right.
Yeah.
And so that kind of fuels that negative outlook of, I'm not going to help these people. They did it to themselves. Um, until maybe you force yourself to look at it from a different perspective. And
Yeah.
it took me, I mean, I've been in practice for 20 years now. I actually spent a year studying compassion. It started
Mm-hmm.
with a book called Compassionomics, which I encourage everybody to read. And
Compassionomics. Yes.
it's hundreds and hundreds of research articles that show how compassion is healing, not just to the patient, but to the provider. And then not only did
Absolutely.
I read the book, but I actually followed it through and started reading the literature that supports it.
Mm-hmm.
And then I started writing about it. And then the AGD Impact gave me the cover, I think it was September or October, where I wrote a paper on, which had, I don't know, 20 or 30 support um, literature
Mm-hmm.
of how compassion is healing, not
Mm-hmm.
just to the patient, but to the provider.
To the
But
provider. Yes.
to the provider, correct. And so, um, and so then you, and so 20 years in, right, I'm finally at a point where it's not just about me. So let's look at it from the perspective of a patient.
Mm-hmm.
Okay. So what is it that the patient is feeling? So I went back to our last appointment with him, and he barely had enough money for these two implants, which is why I offered to do the third implant for nothing.
Mm-hmm.
Um, and I remember, and he's got a couple of abscesses, and he sincerely did not have the money to treat these teeth.
Mm-hmm.
And he was torn apart
Mm-hmm.
because he's like, I just have no money.
Mm-hmm.
Right. And so then I remember, kind of the sorrow and the sadness about, he almost is like, Doc, don't tell me anymore. I can't handle any more information.
Mm-hmm.
Right. Don't tell me what else is wrong with me. And then I looked at him and I said, if you really want me to, I can stop talking, but I think it would be unethical for me to hold anything back. And then he's like, okay, but he was like so embarrassed, borderline angry. He didn't
Yes.
because he was ashamed of what was going on
Shame.
in his mouth, right?
Yep.
And he was
Toxic shame. Yep.
right, and he was ashamed of not having the money to pay for it,
Yep.
right? And this was a guy that was like in his late 60s, maybe early 70s.
Yeah.
So then I put myself back in the time that I'm doing this exam for him,
Mm-hmm.
and remembering that he really did not have any money, and he trusted me, and he gave me all the money that he had to pay for these implants.
Mm-hmm.
So then, um, so my psychiatrist always tells me, when you are angry, which of course I was when he accused me of forcibly doing this exam,
Sure.
the best thing that you can do in a moment of anger is come from a place of compassion.
Yeah.
And so I went back to the time that I gave him the exam and gave him this information, and I remembered all of these things that he said to me, and I remembered the shame, right? And I remembered his inability to pay for the work that we'd already done, and the sadness that he had all this other stuff that he needed to get done, and he said, I can't deal with you telling me any more of this, and that's really what turned it around. That's the gymnastics that I had to go through, and it's not gymnastics that takes place. Doesn't take 5 minutes. It took
No.
Right? It took 2 weeks.
Yeah. I don't think that there's enough admission on the part of dental professionals how much we think about these people when they're not right in front of us, and we take these things home, and we're turning it over in our minds, you know um and that's I love what you just described. I think it's really important for our fellow professionals to hear that and to know that they're not alone in these sorts of situations. And, I know for me, anger is always my first go. It's my go-to.
Yep,
When I
it's
was
my
growing up,
baseline too. Yeah.
yeah, when I was growing up, everybody was angry all the time in the house, and so you just got angry there. But I know today when I'm angry, okay, that's a flag, right? So behind that anger is some sort of fear,
Yes.
and and usually the fear on my part is that I have failed in some way.
Or there's hurt, right?
Yes,
For
yes,
like for
fear
me,
or
the
hurt.
anger was driven by hurt. I
Yes,
felt hurt that he didn't value what I gave to him,
yes,
right? And I felt hurt that he accused me of forcibly doing an exam. That really hurt.
yeah, yes. Wow, thank you for going there, man, because it's important. I think it's important for us to hear that and to know that we these situations occur. These and your response is completely normal, right? And but what something you and I have both have learned is that to take that step back and look at it again with the eyes of compassion.
Mhm.
And this is what you and I need to keep talking about, yelling about to our fellow professionals is, there's another step you can take. And wow, thank you. And then the story about the woman who held come on, your hand to her heart. I live for that stuff. That makes it all worthwhile. And I've had similar experiences, people whose lives I have changed because I was willing to approach them with compassion, with empathy, with non-judgment. People are suffering. They come to us with pain and shame. And so many of them, it gets made worse when they come in. And that's been my bottom line for over 20 years too. Nobody is going to leave my care in with shame and pain. It's just not going to happen.
But answer me this. So, you and I talked about this a little bit on Messenger prior. I posted my article about compassion over
Yep.
Thanksgiving, and I got creamed. I mean, I just had, and it was mostly men who told me that try going to see a surgeon to take out an appendix and have them heal you with compassion. They were, of course, comparing apples to cars, right? I wasn't suggesting that you don't use anesthetic to remove a tooth. All
Right.
I was suggesting is that you don't have to prescribe Xanax or do IV sedation when you can just build a relationship and you can heal people with a sense of, um, by holding
Mhm.
space for them. But what is your opinion on this? Because I think part of this experience of um, trying to protect myself. I mean, I just can't believe some of the stuff that people told me,
Mhm.
or how I got bullied that
Mhm.
weekend on social media. But part of me is wondering if the reason why I was attacked so much is because these dentists, and some of them were even younger, which I was in disbelief because I
Mhm.
generally would have thought that it was like an older generation of dentists that would have been not taught the compassion.
Mhm.
Are they just so afraid of emotion,
Mhm.
of sharing emotion with another human being?
Mhm. Um, Thank you for asking, and I completely agree with your assessment that you know, the people who bullied you, they're in a space, they're in a brain space or a soul space where they just can't comprehend what you're trying to say. So their immediate jump to response that they have to get on their keyboard and start typing is this anger, and it comes out as sarcasm or meanness. I spoke to a group of dental hygienists last year, and I read I read the evaluations afterwards, and they were scathing. It hurt so much. Um, oh, she should have stuck to singing. Oh my God. Uh, that was the one that hurt the most. And just other, comments like that. And all I could, after talking with, mentors about it, you know, when we're talking about something that makes people uncomfortable, right? They're going to respond to that discomfort with,
An attack.
yeah, with an attack, right? So they feel that we've attacked them even though we haven't.
Right.
So what's your best offense? Defense is a good offense, right? But that really hurt me. That set me back.
I can't, I can't imagine. I mean, I have, I've had negative feedback. I don't think I've spoken enough to have that, something like that. So, I mean, I've been bullied on social media enough. I just
That's bad
last
enough.
week, yeah, I mean, just last week, somebody said that, how can I trust her? She's the one that cries on videos constantly and just talks about her feelings. Um, and that actually made me giggle until there was someone that I actually thought was my friend that like I get it. People don't stand up for one another anymore. I get
Mhm.
that. But someone that's a friend of mine actually ended up promoting himself. Like, I get it, fine, you're not going to stand up for me, but don't promote yourself when the entire thread, like
Right.
the entire thread was, it started as, hey, do you know Maggie Augustyn? Because all I know about her is that um, she just cries on video after her ketamine treatment and talks about her feelings. Is she really worth trusting? And then the comments kept going, right? And it's like, I get it. You're not going to stand up for me. That's fine. But really, um, are you so desperate for business that you're going to promote yourself amongst these comments when people are bullying me?
Yeah.
That's what hurt. And
Yes.
so
You know
I
what?
understand what you're,
Yes.
yes.
And you are, I love that I've never seen a video of you crying after ketamine treatment. I'll have to
Apparently, so it's funny. I was talking to a friend of mine. I'm like, I'm going to post something on my Facebook. It's like, anybody that finds a video of me crying, I
Mhm.
will pay them $1,000. And I was telling that to a friend of mine. He's like, Maggie, I think there is one out there. But the guy made it seem like, well, I don't know if it was the guy. It was an anonymous. Of course, it was an anonymous
Of
post,
course.
right?
Of course.
Um, this person made it seem like there were multiples. And so maybe there is one out there. Um, but and clearly this person follows me, right?
Okay, clearly.
Because
But
yeah.
you know what? And you mentioned that you have a psychiatrist. Hello. Everybody needs a psychiatrist. We all need one. Okay. Anybody that you know Serenity is the name of my philosophy, right? And serenity comes from serenity and dentistry. And it comes from
Mm,
the serenity prayer, which
yes.
is the things to change the things I can. Well, I can only change me. And serenity, a lot of my knowledge base in serenity came from my own experience in self-improvement, in recovery,
Mhm.
in therapy, in, from reading books, from a little bit of this, a little bit of that, a little bit of this. And if I hadn't have done all of those things, there's no way I would be where I'm at today. And I don't know why anybody would well, I guess again, it's fear, right? Why anybody would poo-poo another person's attempts to heal, to be a, and it's not even a better person, it's a healthier person, a more, healthy, heal, whole. They all come from the same root. Okay, when I start to put together these pieces of my fractured spirit, right, I become whole. And I why would anybody not want that?
Well, it's for the reason that we talked about. They are incapable of kind of dealing with their own emotions. They just can't feel. They don't want to feel. Feeling is too uncomfortable.
Yeah. Well, and so I have a feeling that you and I have walked a very similar path. And sometimes on the path, I think we think that there's somebody out there, there's people out there that are like somehow uh never ever had to deal with any of the stuff that we had to deal with. And I don't think actually that that's true. I think that, when everybody's got dysfunction. I always say, I always thought my family was the most dysfunctional family ever. And when I've learned now that there's a spectrum, right? Over here you have the Brady's, and over here you have what, like the Mansons or whatever, and my family was somewhere in between. So there's, you know, all this comparing, I
Yeah.
guess is what I'm getting at. This comparing that I always was doing of, putting myself one down, one down, one down from this one, from that one. Somewhere out there, there's a hygienist who's better than me. There's women who are prettier than me. There's women singers who are more successful than me. There's mothers who are better than me. Oh, that was a big one. So, this so and that comparison, fuels a belief system that is inherently false,
Mhm.
but I
We,
buy it.
we all do. Well, so biologically, we are programmed to compare. It's evolution, and we
Mm-hmm.
had to do that. We had to be very vigilant about what was going on around us in the prehistoric times because
Mm-hmm.
we needed to survive, right? So we needed to know where the bigger animals were so we weren't going to be eaten. We needed to pay attention to how other tribes planted their crops, and we needed to compare how we planted our crops so that we can continue to evolve.
Mm-hmm.
And so it's innate in us and in our DNA, and it stayed with us.
Yeah.
But of course, at this point, it has become a very, very significant liability that is fueled by social media.
Oh,
Um,
yes, yes.
right? And so here's a really cool exercise that we can do. Um, when you scroll through social media and you look at the people that you either, well, think you dislike or think you compare to or think you look up to, right? And you scroll
Mm-hmm.
through their social media and you're looking at their life and you're like, wow, their life is so cool. I wish I lived their life.
Mm-hmm.
My life is just, it just sucks and I'm tired um, and it brings you down. One of the things that you're not doing is you're not going to your Facebook group and you're not scrolling through your own social media and
Mm-hmm.
you're not looking at yourself through that other lens and you're not looking through your life saying, wow, like this is my life.
Mm-hmm.
And it actually looks just as good in pictures
Mm-hmm.
as their life does. And then the
Mm-hmm.
other thing that, of course, we forget is that we are comparing our worst moments to somebody else's best moments.
Yeah.
And I remember being at a course, this was many years ago, probably 13, 14, 15 years ago. It was a cosmetic course. And see, when you go to a cosmetic course, well, I haven't been in one in a long time because I don't do cosmetic dentistry, but this cosmetic dentist showed this incredible case. And we're looking at it and we're trying to pick out which is the natural tooth. And it was just one upper, one central
Mm-hmm.
that was a crown or veneer, whatever it was, and we're like, wow, you can't tell the difference. And the guy, what was unique to him is he's like, how many tries did it take to get that crown right? And we're thinking one, right? Because that
Mm-hmm.
is that's
Yes.
what we're thinking, right?
Yeah.
The guy is an incredibly successful, cosmetic dentist. Of course, it's only going to take him one try. And he's like, this is the seventh crown,
Wow.
right? But what did we imagine? We imagined that it took one try. And
Mhm.
then when it takes us 3 tries, we feel like a complete loser because we're telling
Yes.
ourselves stories about what somebody else, did when it's actually a, complete fallacy. And so all of these things are just a matter of perception and a matter of how we lie to ourselves about what's going on in other people's lives.
Yes, lie to ourselves about what's going on in other people's lives. Yeah, it's so important, I think, for people like you and me to be able to have these sorts of conversations in public, right?
Yeah.
And put it out there. Um, vulnerability is rare. It's so rare in general society. In some of the circles that I travel in, vulnerability is much more common and it's, highly rewarded. But in general, out in public, when you're out there in Target or whatever, I'm feeling so vulnerable. You just don't do it. But I think it's important to offer a glimpse
And
to,
yeah,
especially to our fellow dental professionals, um, to give some hope, give some courage. Hope is so incredibly powerful. And you know, I think that there are more people like you and me than we think there are, but they're like we've already said, they're afraid. And when you and I get up here, get out there and put this kind of stuff out there, we give them hope, which can give them some courage. And I'm just I'm so proud of us.
I love it. And here's the thing, I'm like you. I don't talk about the weather. I don't associate with people that talk about the weather. Like I just walk away. I would rather sit on the couch than talk about, than go to a party with a bunch of people that talk about the weather. It's not worth my time. And I spend too much of my life hanging around people that talk about the weather. Um, I don't know that we can change the people that just want to talk about the weather,
Hmm.
but we can certainly empower those who are stuck
Hmm.
amongst the people that, talk about the weather and don't want to talk about the weather to find more people like us. Actually, there's somebody that I found on Facebook the other day that was saying how unbelievably unkind people in dentistry are.
Hmm.
And one of the and I said, and I agreed with her. I said, you're totally right. There's a
Yeah.
lot of jerks out there, both patients and team members and dentists. You are so right.
Hmm.
But I'll tell you this, you just haven't found your people.
Yeah.
And PM me and I'll show you where to hang out.
Yeah.
And
Yeah.
Sober Life Rocks is one of those groups. Dental
Yes.
Entrepreneur Woman is one of those groups. Like
Yep.
those are the people that are not going to talk about the weather. And those are the people that will uplift you. It's all about collaboration and not competition.
Hmm.
Like hang out with us.
Hmm.
Because it is a dog world out there. And you're right. I am proud of us. And we are changing things. Okay, maybe we're doing it slowly, but
Yeah,
it's not
very
the same.
slowly.
Yes, yes. But I think we're gaining speed. It's not the same world that was there 20 years ago,
Yes.
25 years ago, 30 years ago. We don't have to hide in the shadows anymore.
Yeah. Yeah. And let's bring back woo woo. I love that expression. And I'm all about the woo woo. And wow, we've been on here for 45 minutes and I just want to thank you. Thank you so much for coming on with me today and and going there, right? And being willing to be vulnerable and talk about stuff that I think really, really matters. And we're both gonna just get back out there and keep doing it.
Yeah. Elizabeth, thank you so much for what you're doing, for what you're bringing to the world, for getting back up there again, despite somebody saying these cruel and awful things to you, and for recognizing, despite the pain, that what they said was about them and not about you, because that distinction is so hard to make,
Yeah.
especially as you feel the pain of a comment like that.
Yeah.
And yet, just like my phone says, you do it anyway,
Yeah.
right?
Yep.
That's the stoic way. And just how beautiful is that? And so you are doing your part in getting us to the other side of finding the freedom and feeling like we could live to be who we are.
Yeah. Yeah. Unapologetically.
Yes, unapologetically.
Yeah. So, I've loved every minute of our talk today. I've loved meeting you in person, and I hope to meet you in real person, IRL, um, very soon.
Right back at you, sister.
All right. So, God bless, and
God
we will
bless.
talk soon.
Yes, thank you.